Imagine a world where you could pick the best doctor for your care. Can patients really see a difference in their healthcare outcomes, and will they spend less on care if they select a highly rated provider?
I'm here to see Dr. Stone. Is he your very best doctor for any replacements?
Oh yes, he's very nice.
Now, imagine that you have the tools available to search for the best provider before your appointment. As you can see here, there are wild variations in quality of care even within one hospital system. So, even though Dr. Stone is the nicest doctor in the practice, he is not the most highly rated. In fact, Dr. Plum is. What if the patient had instead chosen to see Dr. Plum? Since Dr. Plum is the most highly rated knee surgeon in this medical practice, what difference would that have made for the patient? Can patients really see a difference in their healthcare outcomes, and will they spend less on care if they select a highly rated provider? Hey everybody, and welcome back to Cup of Joe, our monthly series where we dive into employee benefits to help brokers and employers navigate the complex world of healthcare. Today, we ask an important question. Does your choice of doctor really affect health outcomes? Or are all doctors essentially the same? After all, they all went to medical school, right? Well, the short answer is no. All doctors are not the same. And yes, the doctor you choose can absolutely impact health outcomes. But there's another key takeaway for the employer-sponsored healthcare space. An employee's choice of provider can also influence health insurance costs. So, how can employers help steer their employees towards high quality, cost-effective care? Well, at the Difference Card, we believe the answer lies in recognizing that, like any profession, some providers are simply better at what they do than others. The challenge, though, is identifying these high-quality providers. It's not as straightforward as we'd like yet. That's why we're committed to building technology that empowers our members to make more informed decisions. And we're doing this by sorting through billions of claims, real data, rankings, and objective outcomes. Think about it. We've all been conditioned to rely on reviews for everyday decisions, whether it's choosing a restaurant or buying a product on Amazon. You wouldn't dine at a place with a 2-star Google review or buy a product on Amazon with 1 star, right? But when it comes to healthcare, arguably the most critical decision of all, people still make choices blindly without any real insight into the provider's quality. And why is that? It's because the current state of the healthcare system, unfortunately, does not provide easy to access objective provider ratings. You may be able to see a hospital network ranking, but within that hospital, good luck finding any objective quality measurements for specific providers or surgeons. And without transparency, it's like rolling the dice with both your health and your wallet. This is where a bit of a prediction for 2025 comes into play. I believe 2025 will be a turning point for healthcare. I predict more employers will adopt solutions that allow their employees to search for providers based on important metrics like outcomes, readmission and complication rates. Quality won't just be about cost anymore. It'll be about the entire patient experience. And of course, this won't be simple. While measuring cost is relatively straightforward, measuring quality is much more complex. For example, what about doctors who treat high-risk patients who are naturally more likely to experience negative outcomes? Fortunately, technology and data science are evolving rapidly, and we're getting much better at identifying and adjusting for these variables. Here's the bottom line. We can't let perfect be the enemy of good here and stop us from making progress. At the Difference Card, we aim to lead the charge in 2025, shedding light on provider networks and making transparency the norm. After all, as the saying goes, sunlight is the best disinfectant. Thanks for tuning in, and I'll see you next month on another Cup of Joe. Thanks, everybody.